All right, so this is going to be a demo of a live build that we're building. Well, I'm building in public just for, I would say, I gotta change the wording here, but it's going to be assisted living facilities. It's just going to be a healthcare hub. Um, I'm making sure that we have all of these that are going to be basically features that are in the app. The pricing, eh, I don't know if I want to keep the pricing on there, but right now I think that's the pricing that I'm going to offer. I actually have to update this and get real names because that looks trash. Maybe not put my email address here, but you guys can email me. Actually, I should leave my email address here so you guys can email me. And then this is how to try the demo if you have login information, which nobody should. But this is how to try the demo with different users. But right now we're actually building out the users. So I'm going to just show you the users that we have right now. And then what I would like to do is go to admin. So we're signed in as admin. And then what we just have to go ahead and make sure that we're playing around with is that we have the admin right here. Once I put this live, hopefully people are able to go and play around with it and give me feedback. But the big thing that I would like to do is just make sure that we have patients enrolled. I'm not really sure if I'm going to be using the word patients because it's assisted living. But as you can see right here, it's 550 complex versus non-complex. Well, if they're not really heavily medicated or experiencing a lot of medical needs, then it's going to be non-complicated. Then it's going to be complex if they just basically are complex. And compliance is going to be the compliance as to how the assisted living facility is doing, how they can go ahead and improve. The big thing right here is going to be occupancy, as to the assisted living facility, how many beds do they have. The tasks are going to be, what are today's tasks, so the admin can go ahead and see that. Again, the resident types, complex versus non-complex. The billing as to what's being billed, and this is going to be the program with the billing codes, as you can see right here. Kind of matches the billing codes as to what's being billed. I need to go ahead and think about this a little bit through and through as to how this is going to work. Maybe it's too much information, but again, I'm looking for more, I would say, CNAs, nurses, doctors that actually work in this space to go ahead and give more insight. And this is going to be the patient list. This is going to be their profiles, if they're enrolled and whatnot. Again, this is going to be the medication. So this is just the dashboard here. This is going to be the residents. I should be able to go ahead and see, the types of residents that we have. Obviously, again, this is the demo. The staff. The staff is going to be, what department they're in, who's on staff, who's on leave, as you can see right here, and then basically the training, and then also the activity log as to what they're doing when they are signed in. This is going to be the big pushing point for the app. It's going to be basically staff scheduling. So the big thing that we want to make sure is that we understand, hey, the range, we should be able to go up to 2 weeks, but for right now we're going to just play with 7 days, and this still needs to kind of be built out and ironed out. But what is supposed to happen, we want to go and make sure that we're optimizing the preferences. The person who is signed in, the admin, would know that whoever or however many users are in the platform, they have their scheduled preferences, and then the AI should be able to go ahead and just automate the preferences, maximize any overtime if that's something that they want to do, and do balance overload. So if we didn't want to maximize overtime, we wanted to reduce it, we can go ahead and make sure that we turn this off or turn this on, either or. I'm still working on this. And then how it works is just going to go ahead and give you a list right here. And then what we would do is hit generate, and then maybe I'm in the way, but you'll be able to go ahead and see. Actually, am I in the way? Probably. Oh, but what we should be able to do, there we go. What we should be able to do is see exactly, the coverage, the conflicts, and then what I still need to do is build this out. But overall, this is being built in, like I said, in public, and this is what we've come up with so far. A lot of other things need to be built out. This is going to be the medication, basically management, just making sure that each either resident or patient is getting the right dosage of medication. Make sure that nothing's overdue, all medications, so we are able to go ahead and keep track of it. If we need to go ahead and have an API integration, we would be able to go ahead and just custom match the custom fields from that API or even webhook. The tasks, what the tasks are going to be done either for the resident or the tasks for the staff. What are they supposed to be doing today? As you can see right here, like morning medication check, physical therapy session, yada yada yada. And then once it's done, you're able to go ahead and just check mark on that. We just have to go ahead and make sure that's finished. But we can see what is on today. We can see what's upcoming. We can see what's overdue, and then we can also see what is complete. Telehealth, that's going to be something that we're just going to go ahead and build out using Zoom. We just have to have a BB or BAA signed. This, I'm not really sure, to be honest with you. So I'm just thinking about this out loud. What needs to go here? Again, feedback is necessary in order to build this app. Activities, what's going on with the activities, meaning that, hey, what do we have upcoming for today? Who's participating? And this is mainly for the residents and whatnot. The shared calendar, this is going to be cool because we can go ahead and see the staff schedules. We can see the resident activities. We can see the medical appointments, and we can go ahead and see all that on one calendar. Messages, this is going to be something that is going to be, when a family member is able to sign in, they'll be able to have their family portal, they'll be able to check on the residents, they'll be able to see and ask questions to the care team, they'll be able to see exactly what that resident is doing for that particular day or for that particular week, and then they'll be able to go ahead and message the resident or an internal care team. And then as we scroll down, we see that we have the admin. This is going to be the admin dashboard. This is basically where the admin is able to go ahead and just put their information in here. They're able to go ahead and basically find out the most important information, how many people they have on staff, what's the monthly payroll, what's pending for time off requests, how compliant are they with training. This is going to be the staff here. This is going to be the payroll, as to how many hours they're doing, and then these are the benefits. Do I really need this? I don't know yet. Am I doing too much? Could be. But again, we want to go and make sure that the admin has everything that they need on their dashboard. Again, maybe I don't need that there. So we're going to talk about this because I don't need this here. But I'm just giving you an overview of the app and how much information still needs to be put in a live build. And then for compliance is that, the trainings and whatnot, basically the integrations, as you can see right there. We have the documentations. You can go ahead and import, export documentations. You have the audits, basically, again, this is all at a high level, so I would still need to go ahead and make sure that I'm working with my team or anybody who's going to be able to go ahead and give me insight and feedback as to what needs to be compliant ready, as we can see right here. And then we have the billing, but really the billing, not really, nothing there. We have the role management, so when you're able to go and put a custom role in there, you're able to go ahead and see the permissions, and you're able to go ahead and say user assignments. And then, again, this is just going to be the admin, so that, like, a couple of things, maybe I don't need this here, the staff management. I will need the billing report, so I'll go ahead and make sure I build that out. And then the system settings, I'll make sure I build that out as well. And then this is just going to be the resources, what training the staff member or anybody who signs into the system is going to need, who's employed. And then the activity log, basically who is doing what in the system, so that way we can go ahead and have an audit trail. This is going to be basically the support and documentation. I'm still thinking of making an AI bot that's going to be able to go ahead and help with this information. So it's going to be able to go ahead and tell you which user needs to, do some trainings or give you some documentation. So just having the AI widget in there would definitely help. And then here it's going to be just the basic settings. So you can go ahead and set this up for your profile, your billing, your account information, your notifications, appearance, integrations, which is going to be important, and then all this other jazz. Now, with that being said, I know I took a lot of time here, but hopefully we can go ahead and get this built. I still, like, for the UI, I'm still learning the UI, but again, it's just gonna be the ability to get feedback. And once I am able to go ahead and get the feedback as to what needs to be built, I can go ahead and hopefully have this launched and ready for investors to invest. We go live. Thank you. That was nice.